for you.
Welcome back, and thank you for staying with us. Well, you know that all over the world now, or should I say in some parts of the world, people are now taking the COVID-19 vaccine. So as countries around the world continue to procure COVID-19 vaccines, some medical experts have said that it is not possible for our own campaign to begin this month. That's what the Presidential Task Force had told us.
No, they had
towards
told
the
us
end,
it
towards
could
the end
come
of
in
last
January
year. That's what
this
I'm
year.
saying. That we can't do it this month as they had said we were going to do. So, when are we expecting our own stock of vaccines, and when are we going to start collecting our jabs? These and many more questions we shall put to the Chair, Rotary National Polio Committee, Dr. Tunji Funshaw, who joins us via Zoom. In fact, all our guests on this segment are joining us via Zoom. Dr. Tunji Funshaw, Professor Wale Tomori, a professor of virology, as well as Dr. Alera Roberts, consultant public health physician, who joins us from Cheshire, UK. Oh, Alera, you've run away already. Thank you all
yes, it
very
does
much.
look like it, doesn't it?
Thank you all very much for joining us on this segment. Now, what is the implication of us not being able to get our own stocks to start vaccinating in January? Let me start, lady in the panel, Alero, my namesake.
Hi, good morning, and thank you very much for having me, and a happy new year to you all. And I must say how very honored I am to be on the same panel as my professor and teacher, Professor Wale Tomori, and of course, Dr. Tunji Funshaw, whose work has been absolutely incredible concerning the eradication of the polio virus in Nigeria. Well done. Fantastic. So honored. So basically, we have a problem. We are waiting for the very next train, and I have a feeling we're looking at a situation where 2 or 3 trains are going to pass before we get to jump on the vaccine train. The sad thing is we're seeing the effect of it right now in the recent loss of, if I count right, 4 eminent professors, 4 eminent Nigerian professors to the COVID vaccine. And that is not talking about innumerable others who are very valuable to different aspects of our national development. Because sadly, it seems that the spread is taking place in the age group of Nigerians that we really, really need right now that we're looking at economic recovery.
So she was talking, okay, so let me say the Alera in the studio was talking about Nigeria getting this vaccine. How close are we?
Well, we are as close as we can be. We are part of COVAX, which is a global and local community of vaccine procurement. I can't remember the full name; it's just escaped me. I'm sure Professor Tomori will fill us in. And but that means that we are not looking to getting the vaccine much before the end of Q1, possibly the beginning of Q2. Don't forget that globally, this vaccine has to be produced. And there's only so fast that the production can take place, and there's only so quickly that more production lines can be put in place. So we are not going to get this vaccine much earlier than March, possibly April, and that's just what it is.
Professor Tomori, this seems like bad news because we hear the second wave. I mean, not that we hear, we see that the second wave is on in Nigeria because it's no longer figures to us. The figures are rising, and those who are dropping dead now are people that we know. They're not just figures anymore. Oh, somebody died, somebody died. People we know are actually dropping dead. So, I mean, What do we do in the meantime while we wait for this vaccine?
Sorry, I missed quite a lot of what you said, but you're talking about, is this bad news? I think it is terribly bad news. And neither of us knows when we're actually going to get the vaccine we promised. I think the government said something about 100,000 doses coming in, whatever, from Pfizer. They don't even tell us what date, what time is coming in. And other countries have been very proactive. They started paying for this vaccine like months ago before they took a gamble, which is what sensible countries do. But we're not. So, of course, we are waiting for the crumbs that will come after they have satisfied themselves. And remember, some of those countries are buying like about 5 times what they need. And they're not going to release anything to us until they make sure that all their people are satisfied. That's where you have a sane government, that you have a country, a government that cares about its people. So for us who don't have, like people say, when you don't have a mother, you don't have a father, you try not to get a sore at your back. Unfortunately, Nigeria has got a sore on its back, and how we're going to get that to be. So we need to work together. And what do we need to do? The most important person in this control is not the government, it's me and you, is that individual. Remember, this is a vaccine. We talk about mobile phone. Our phone is not mobile. We are the ones that carry it around and make it mobile. So also is this virus. It's not mobile. We are the ones that make it mobile. And therefore, what we need to do is to make sure that we stop it in its track by following those non-pharmaceutical interventions. Wear your mask everywhere you go. Wash your hand, and do all those things that will make it possible for the virus not to be moving from one person to another. I think that's the only thing you and I have only can do. It's in our hands. It's a choice between getting COVID or dying. I don't know when the vaccine will come. You remember with COVID, we signed a non-binding agreement. And our country is still planning. When we plan for yesterday, tomorrow. That's what we do. Other countries plan for tomorrow, yesterday. And that's where we are. So it's left in your hand, it's left in my hand to protect myself. When they say don't go to those public parties, let's stop all these weddings and all these whatever for some time. And let's put so that we can keep ourselves safe. Religious people say church, church, church. Is God not everywhere? God is omnipotent, omnipresent, and so he's in my house. Why am I going to go to crowd and go to the church? So let's have people reason. It's my life, it's your life. So focus on that. That's what only medicine we have. Over.
Yeah, Professor, I'm sure I didn't hear you right. Did you mention Pfizer, 100,000 doses of Pfizer vaccine? Did I hear you correct?
Yeah, that's what we were told. That's what we were told. And that is going to, I don't know when they said it's coming. And that's 100,000 doses. That means only 50,000 people out of 2 million people, 200 million people. South Africa has bought 1.5 million as their first batch. They went straight to the Serum Institute of India to buy. Nigeria is waiting for cover. We're waiting for donation. We're talking with the Foreign Office of China, all those things. That's the thing. And sometimes one gets a bit frustrated about this country, but we cannot be frustrated. It's our country. So we have to keep on pushing and pushing and pushing. 100,000 doses, and we put it on the NTRC. That was the greatest achievement we've ever had.
But Prof, Pfizer is the one that has to be stored at minus 70 degrees. Am I correct?
Of course, you are correct. And so it shows you the kind of stupidity we have as a country. Why choose that one when you know you don't have the facilities at minus 70 degrees? They try to tell us, where we're going to get dry ice. Where are you going to get dry ice? The factories that will produce the dry ice all folded up years ago. Go to Ikeja, that's where we used to do all those things. I remember those companies when they used to get dry ice from them. Where are they today? Yet we are getting this. But then remember, 50,000 doses is limited to, hopefully, a select few. And so they can take care of themselves while the rest of us suffer.
Oh, Prof, I can feel, the passion and the frustration that, you're talking about in terms of, all of these issues around COVID in Nigeria. You've talked about some of the safety measures that you say they are in our hands. It's left to us to take charge. But why does it seem that a lot of people don't want to follow these safety measures or take this safety protocol seriously? Because you go out and you still see a number of people not wearing their masks, not, giving space, wherever they are. Why is this so?
I lost you again.
Okay, Prof, I was talking about why does it seem so difficult for a lot of people to follow these safety measures or some of the safety protocols that you've talked about?
I think there are two important things. First of all, we as a people, we don't care too much about our health. I mean, that's the only way I look at it. And then government has failed to make it important to us that the most important control in this epidemic are the people, not the government. It's not the PTF. It's not the whatever. They have a role to play.
Oh, okay. Let me go to Dr. Funsho. You've heard about the fact that we are waiting for our vaccine. Is there anything we can learn from, how we tackled polio, in taking care of, COVID, even though, of course, they're different diseases?
Thank you very much for inviting me. I think, I'm privileged to be with Prof, who is a world-renowned virologist and our own, very erudite public health specialist, Dr. Roberts. I think, Prof has, moved us away from this lack of vaccine to what we can do. Really, I think it's a little bit premature to be talking about vaccination as a priority. We want vaccinations to come. But we must realize that even if we get the vaccines today, all those basic protocols to stop the epidemic in Nigeria will have to continue for at least another year. Even if we get the vaccines today, we still need to wear our masks. And that is the most important aspect of putting barrier between ourselves and the virus. And we need to put a little bit more energy into communicating the need to have this done to the community. I remember we have something, similar to getting people to take basic precautions and get vaccinated against polio and other vaccine-preventable diseases. Our job is cut out for us. This vaccine is not going to get to us before the end of this quarter. So we must learn to live with that. I think the important thing now is, in the meantime, how do we protect ourselves and our people against succumbing to infection with the virus? And we need education. We need, community mobilization. We need the media. Like Prof said, government has a role here, but the role of government is really quite minimal, very minimal. So I want to plead with all of us to get involved, to educate from our families. I have, even within my own family, those who don't take these things serious. And that extends to the wider community. So all of us to, take responsibility to ensure that we educate people of the need primarily to wear masks. Of course, other things follow from that. Large congregations, particularly indoor congregations, should be avoided. We can do without a lot of these things. Many people have been doing that, and that has not stopped their lives in its track. This virus is going to be with us, vaccine or no vaccine, for a long time. We're going to start at the appropriate time advocating for the vaccine to be accepted. But until the vaccine is available, what we have with us that is very, very effective is following the protocols, which is wearing masks in public places, particularly when we live in our homes, safe distancing, even where we have our masks on outside. Avoid indoor assemblies, because the virus is spread not only by droplets, but also by aerosols. So if you are in an enclosed space, that virus is hanging up there. The person who shared it may have walked away an hour ago. And you come into that room and you are going to breathe quite a large chunk of that virus. And if you are vulnerable, you get infected. So it is very important, that we appreciate the need of what we need to do in the short term before the vaccine comes.
Okay, Doctor, we'll come back to you. We'll just take this quick break. And when we come back, I think I'll also bring in Professor Tomori to tell us about this talk around herd immunity. Do we have it now in Nigeria? To stay with us. Welcome back. Okay, we were talking with Dr. Tunji Funsho before we went on that break, and he was talking about complying with the safety protocols. What more do you have to add before I move on to Professor Tomori?
Sorry. Okay, sorry.
Doctor,
what I would like to add is that, can you hear me now?
Yes, please go ahead.
Yes. What I would like to add is that it's not, saying that vaccines are not important. They're very important. I want to underscore the fact that we'll need these vaccines, but whilst we wait for the vaccines, there are things we can do that are very, very effective for putting a barrier between us and the virus, and that is observing the safety protocols of COVID-19 as set out by the National Center for Disease Control. Okay.
Professor Tomori, I will still come back to the issue of the herd immunity, but let's talk about the new variant. Of course, the United Kingdom is barring some African countries from coming into the country because of, this new strain. Tell us about this. Is it more virulent and more transmissible?
Hello?
Hello, Prof. We can hear you.
Sorry, I lost you there. I didn't get the question.
Yeah, we're talking about the new variant of the COVID-19 virus. Is it more virulent and more transmissible? And do we have it already in Nigeria?
The story we have is that they have in UK, they have in South Africa, and the UK one is spreading to different parts. So far, the information is that it is more transmissible, but it does not mean that it is more virulent. There's no evidence for that. Yes, it transmits much faster than the other one, but there has not been any concrete evidence to show that it is more virulent. But the fact that it is more transmissible means more people will get it, and also that increases the chances of many people not only getting it, but also getting infected and possibly dying from it.
Right.
Okay.
As to whether we have it in Nigeria, as to whether we have it in Nigeria now, we don't have evidence because the study we've done has only been up to October. I was told that the efforts are being made now to get more samples from different parts of the country. And so maybe in another 2 weeks, we'll be able to know exactly where we are in the country.
Okay, so the Nigeria Institute for Medical Research is, according to one of the professors there, is conducting this study on herd immunity. We want to know if indeed the country or the people will have this immunity against this virus. But and in the light of that, they are calling for caution in the procurement of this vaccine. Okay, so the professor we had, Professor Rosemary Aldo, said that yes, she would go for vaccine, but we need to do more in terms of research to know if, one, this vaccine that is going to come is not going to, cause maybe some kind of breakage in the line of what seemed to be working for Nigeria. We have the cases, yes, but if you compare it to some other African countries, it is not as high. Do you agree with that?
No, I don't. And let me come out straight away. I saw that article where it says COVID-19 vaccine would destroy herd immunity. That's all bunk. The experience we have, and Tuji will also confirm that, we continue to vaccinate our children. We continue to vaccinate our children during the polio to increase the herd immunity. Repeated vaccination at the appropriate intervals increases the herd immunity, not the way they are saying. None of them knows what the herd immunity is to start with. They said they're just studying it. I heard somebody saying about 70%. That is not true. Because even in other parts of Africa where we've done the herd immunity studies, it's been less than 20%. In Europe, in Africa. So to come and say because you have herd immunity of 70%, and therefore, in any case, if you now know my immunity, are you going to set me out and say you don't take vaccine or you take vaccine? The normal procedure, the repeated vaccination at the appropriate interval increases the immunity of the people. So it's all, I mean, I quickly went back and corrected that in the next day, that it is not correct. And I think we should be very careful. And I wanted to believe that they were misquoted. But if they're not misquoted, then it's a wrong assertion. That is not basic immunology. Immunology says if I get an infection and give me a second challenge, there's what we call rapid development of immunity, which is called anamnestic reaction. That's what you get, not destruction of your immunity. When you get it at the right time and get the second, a third, or fourth, it increases your immunity. Please, let's get that message out to our people and not create unnecessary panic among the people.
Okay. Dr. Roberts, we're back to talking about immunity again. Can you please remind us? Because whether it's the first wave or the second wave, we need to improve our immunity, and that way we may just be safe. Can you just remind us again how we can improve and increase our immunity?
In this particular instance, Sismi, let's be very, very frank. Both Professor Tomori and Dr. Tunji Funsho have said it. The only way we can protect and improve our immunity is to keep away from the virus. Like Prof said, it's basic immunology. If you get infected with a tiny inoculum of virus, you challenge your immune system to produce antibodies. If you get infected with a massive dose of virus, you're on your own. The only way you can minimize your exposure to the virus is by distancing, masking up, hand washing. So far, that has been working. It is very, very sad, but it must be mentioned again and again. We lost 4 professors, and I happen to know this personally, and I've lost 2 other friends in the last 48 hours, mind you. You know, that which is making it real. Like you said, the numbers have names, and the names are people we know. It's because they were all at super spreader events. Now think of our classic social event. You are in an enclosed, air-conditioned environment. You are there for many, many hours. The music is playing loud. So you want to talk to your friend, you lean in close, and you are talking directly into the person's face for hours. Why won't you get exposed to a massive inoculum of virus, get sick, and die? That is precisely what is happening. There are no immune boosters that can prevent that. The only immune booster that can prevent that is stay away. Wear a mask when you're outside your house, or better still, don't leave your house at all. I have the privilege now of sitting in the UK and watching firsthand the battles they are facing. So we're not unique in this. This is not a Nigerian thing. This is a global thing. London is declaring a critical incident. They have no hospital spaces. Oh, now we want to come to Nigeria and do what? I know a friend of mine managing a center who is having to play eeny, meeny, miny, mo, determining who should come in and who should not come in. I've got other friends who are out on holiday somewhere in the Middle East, now all sick with COVID. Of course, they are at the back of the line. That country is going to take care of its own nationals first. There's no immune booster. There's no preventing, there's nothing that you can do to your immunity other than stay at home. Do not go to these super spreader events. If you must go out, wear a mask. And don't wear the mask on your cheek. Wear it to cover your nose and mouth. Wash your hands frequently. And if you can't, use an alcohol-based sanitizer. So far, that is working. That's about the only thing that we know that is working.
Doctor, let me paint this scenario because I had this discussion with a woman at the market. And of course, I was wearing the mask and I was trying to ask her, how much is this? And she said, I should remove the mask, she can't hear me. And I said, no, this is how I'm going to communicate. She said, this thing is not real. I know we've talked about this before now, even, you know, when COVID just came and people were saying it is not real, this is malaria. But this woman just last week is still telling me that this is not real. It is malaria that we are all talking about and giving it all sorts of names. What do you say to such a woman?
Now you are going to really put me in trouble, because this is where the real Dr. Lero Roberts is going to come out publicly. You don't have to be a statistic. The truth of the matter is stupidity kills. And unfortunately, stupid people are still going to die. You don't have to be one of them. If she can't hear you, she's not the only woman in the market selling what you want to buy. Move on. You're not going to get COVID simply because you want to buy tomato. If she doesn't want to believe it, fine. That's all right. You have value to yourself, to your family, and to society. Move away.
So that's the woman at the market. But we also have some other prominent people who think that, you know, we're giving it too much attention that it deserves.
We are seeing the reality now. We are seeing the reality now. As Smith said, these numbers suddenly are now beginning to have names. And these are names of people we know. Eventually, this is what is going to happen. It can be said that this global pandemic is almost like a cult. Maybe we're too many on the planet, who knows? But we have a choice. We have a choice not to be a statistic. We have a choice not to be an obituary. We do have those choices. And as much as possible, for the value of ourselves, our families, and our society, we need to exercise the right choices of staying away, staying at home, staying away from indoor assemblies. God is everywhere. You don't need to go to the mosque. You don't need to go to church. We need to be clear in our messaging. This is a juju disease. We have said it in the medical community, and we're losing doctors, not just people like me who leave the country. We're actually losing doctors to the grave, because doctors, nurses, chest physiotherapists have no choice. They need to get up close and personal to people who we know are carrying the virus. It's not fair. It's just not fair. We need to just pay attention and do what we know works. Stay at home. Keep away from indoor assembly or any kind of crowd. Wear a mask when you're outside your house. Wash your hands. How many times am I going to say it? Shall I say one more time?
Yes, there's that time to say it. Let me quickly go to Professor Tomori. Dr. Funsho said that we need more energy, you know, to put into this communication about these issues around COVID. What's your assessment of how far the Presidential Task Force has done in this area, and by extension, the state governments?
Thank you very much. I just wanted to add that an idiot is still an idiot if he's prominent. We have some prominent idiots who are heads of state, so we shouldn't worry about that. He's still an idiot. You know, that's the point. So whether you're prominent or not, if you're stupid and foolish, then you're foolish. And as the other side, a carpenter comes to tell me that he wants to repair my car, I would be a stupid idiot to let him do that. So these are important things. There are a lot of people who make statements who don't know what they're talking about, irrespective of their prominence. So we should be careful about who listen to that one. I've seen some videos in this country by people who have no right to be saying what they're saying, but yet they say it, but we listen to them because we say they are prominent. They are idiots. They're not prominent people. Anyway, that's number one. What do we need to do? Whether the task force is doing as well. Let me be fair to I've been involved in some activities in which the MPHCDA is doing what you call frequently answered questions or asked questions. We need more of that to counter all of this information that is going on and telling people, showing examples of countries that did the right thing. New Zealand is a very good example. Taiwan, I think Vietnam, they enforce the law. If you dare not to wear your mask anywhere, you go to jail or they fine you immediately. So we need to enforce those things and use those people's example. And as I said, we're MPACDA, they're all part of the PTF. I have a different attitude about our PTF. It's Presidential Task Force, but whatever it is, that's a different story. I don't think they've done right enough. They've not focused on the people. And most of their attention has been government doing this, government doing that, government doing that. So we need to get that message, the frequently asked questions, down to the people. Anytime anybody comes out with a wrong information, immediately, we don't wait. And government should be very proactive in what they are doing. By that I mean, no government is infallible. We're all human beings, so we'll make errors. Let the government come out and tell us, we've done this, we're incapable of this, we need help in this area. That's when people begin to trust them. But when you keep saying, do this one, do that one, without actually telling you, we're seeing your failure, but you're pretending you're not failing, then of course we won't believe you. So they should be, out there telling the people, these are the areas. You remember, let me say one more thing. You remember the time when we started having the impression that no more COVID in the country because the numbers were dropping. It took us, simple analysis showed that was around the Salah period. The weeks before the Salah, we were testing like about 11,000 samples per week. The Salah week, we're testing just about 4,000. Of course, your numbers will drop. And when those numbers started dropping, we started warning people, it's not that the numbers are dropping because the cases are not there, but because we are testing less. It took the PTF 2 weeks to make that statement that they were not testing well. By that time, every Nigerian believed that COVID was gone. It was too late now to come back. So you must be proactive. When action is going, take action, correct the information as quickly as possible, and let people know exactly what you are doing. Why this? Don't wait for 2-3 weeks before you now say, oh, the last time we're not doing that one. And that's where I fault the PTF. I think they need to be right there on the moment. And you remember our country wanted to disband the PTF until the second wave came, and then the president said, oh, their life is extended until March. Don't give them any, they stay there until we sort this problem out, but then do the right thing.
We've had some influencers who have actually recovered from COVID coming out and telling us their experiences. Like this week, we've had Alibaba, the popular comedian, coming out and telling us how he almost lost his life as a result of the infection. How effective do you think this has been? Because in spite of people we know recovering and coming to tell us their experience, which is less than palatable, people still don't believe that there is COVID.
We need more of such people outside. In fact, if I were in charge of your TV stations, your headline news would be that one, not Buhari went to Daura. It will be that statement with Alibaba as the headline news. And at the end of the day, Alibaba as the closing news, so that everybody hears all the time. Because most people, what we see on our paper, our president did this, that one, did that one. But yet, the one thing that affects the life of the people, well, how does it affect me whether my president went to Daura? But then if Alibaba comes and tells me, I went through this is where I am, and many more people coming, and you make it the headline news, then everybody knows that there's a major problem in their hand. Again, the message is you are the most important person in this COVID business. Until we begin to let people realize it, the question is, what is in it for me? What is in it for me if I don't wear my mask? I probably will get infected. I would die, and if God forbid. But then if I'm the breadwinner from my house, I keep thinking, what's happened to my wife? What's going to happen to my children? What's going to happen to this? That's when we begin to keep stressing that important point. If COVID catches somebody in the government, how does it affect me? Somebody else will replace him. But if you are the breadwinner in your house, then nobody replaces you. So you begin to look at that. That me, I'm the more important person in this situation. So I shouldn't get this thing. Get that message down to our people. You are number one in COVID control, not the government, not the president, not the PTF.
Okay. As we wind down now, Dr. Funshaw, what do you think the states can take away, particularly in terms of passing on this message at the grassroots level?
I think just like we did, with polio eradication, I think we need to involve our traditional structure. I don't think we're using them enough. We also have right to what level? We have civil community groups that are known to the community, who know the community. They virtually know every member of the community. I think we need to have this communication thing sorted out. It is not difficult. We only need to decide to do it. And once they get convinced about the need for maintaining the COVID-19 protocol to prevent ourselves and also our communities from getting infected with COVID-19, I think we'll gradually be getting there. As it is now, it is something, like Prof said, we mentioned once. This is something we have to do repeatedly. Our challenge now is that, Prof mentioned, Alibaba. It will trend for maybe a day or two, and that's it. These are the kind of stories we need to keep out there. When you mention it, regularly, continuously, tenaciously, it will sink. But when you mention it once and, next day, another news item that people may find more interesting comes in, that is forgotten. So we need to get our communication right down to the grassroots, and our traditional leadership, structure is a very, very good place to start, because they have influence in their community respects them, their community trusts them, and they will listen to them. And they are there with their communities so that on a regular basis, they can get the information out. And indeed, because they respect them, if they tell their people, don't let me see you on my street without a mask, nobody will dare to do that. So I think we need to involve these powers.
Dr. Tunji Funshaw is Chair, Rotary National Polio Committee. We also had Professor Wale Tamori, Professor of Virology, and Dr. Alera Roberts, Consultant Public Health Physician, all of whom joined us via Zoom. Thank you very much for coming to tell us more about this subject.